These are scenes burned into our collective memories. Thousands of seniors languishing and often dying inside New York State's nursing homes during the early days of the coronavirus pandemic. Out on the streets, residents stepped out night after night at 7 p.m. to celebrate healthcare worker heroes who put their own lives on the line to keep our loved ones safe.
It's not a warehouse.
But Richard Mollett, executive director of the Long-Term Care Community Coalition, which represents families of nursing home residents, says it's now time for Governor Kathy Hochul to make those facilities safer.
I think it's frankly reprehensible to be saying that there's not enough money to provide basic staff to meet people's needs.
On Monday, New York State Attorney General Letitia James joined officers and members of 1199 SEIU, one of the key unions representing nursing home staff. She joined the call for Governor Hochul to force extremely profitable nursing home facilities to divert most of their profits back into the industry, boost staffing levels, and increase staff salaries.
And they have revealed to me conditions in some of these nursing homes which are appalling.
We simply can't find the workers.
But Stephen Hans, executive director of the New York State Health Facilities Association, says Hochul's decision to continue delaying the requirements makes perfect sense, citing decades of Medicaid cuts and a shallow hiring pool.
And here we are in 2022, facing laws that are simply unachievable. Right now, for providers to meet those laws that were put in place by the prior administration, you would need 7,000 to 8,000 workers to show up at nursing homes throughout New York tomorrow.
Governor Hochul's office tells Pix 11 she is not turning her back on nursing homes and lists an action plan which includes requiring nursing homes to make booster shots available, including guidance on a fourth shot, distributing millions of COVID-19 rapid tests, and authorizing EMTs to administer the vaccine. A spokesperson for Governor Hochul continues to say in a statement, quote, nursing homes are strongly encouraged to begin coming into compliance with these new requirements, but in light of the current healthcare worker staffing crisis, Executive Order 4.4 suspended these requirements to prevent disruptions in care or reductions in services at facilities that cannot comply due to the ongoing emergency. The spokesperson goes on to say that this suspension expires at the end of this month and that the administration continues to monitor the situation. We're live in Midtown tonight. Jay Dow, Pix 11 News.